Healthcare is one of the biggest expenses in retirement.
So today we're talking about how your physical fitness can help lead to financial fitness.
Our money expert, Bruce Helmer, joins us now. Good morning.
Good morning. I'm sure people are looking at me going, what does this guy know about physical fitness?
It's
good
important.
shape, Bruce.
Yeah.
Come on.
Okay, so 74% of American couples, is according to a Fidelity study, they're worried about being able to afford that unexpected health care cost.
Yeah.
Understandably so.
Absolutely. So if you think about this logically, a couple things strike me. Number one, the things that lead to financial success or lead to physical success, the habits that we form, are remarkably similar. We set a reasonable goal, a measurable goal. We don't just say, I'm going to wake up someday with $1 million. We don't just say, I'm going to lose 20 pounds. How are we going to get there? What are we going to do? So the habits for both of these actually are remarkably consistent. And then financially, we all know being healthy is cheaper. The obvious example that everyone watching understands is if you smoke, your premium for health insurance, your premium for life insurance is considerably more than if you don't smoke. So if we can be healthy, it impacts us significantly financially.
Yeah, deductibles when it comes to your health insurance plan.
Absolutely. If you're healthy and you can carry a higher deductible, you have a lower premium. But
life insurance.
And back to your point, Kylie, to open the segment, when we look at people that would otherwise retire before age 65, the single biggest reason that they don't is because they're worried about that cost of insurance until they're eligible for Medicare.
We've seen it with coworkers.
That's
absolutely.
It's the number one concern, and it keeps people working maybe longer than they'd want to because they're worried about health insurance. Yeah.
Medicare, I feel like people do think, though, is going to cover a lot more than it does.
That's a brilliant point. Again, if you're not 65, there are a lot of misconceptions about Medicare. Number one, it's not free. Only Part A is free. You pay for Medicare Parts B, C, and D. And the cost can be impacted by how healthy you are or aren't. But the other thing is there are many things not covered by Medicare, which leads to Medicare supplements. And then that leads to things not covered by supplements, things covered by something like long-term care. So again, what the insurances you should have and the cost of those insurances are impacted by your health. And then some things are controllable. I mean, look, we can't keep from ever getting in an accident. We can't maybe keep from getting some diseases like cancer, but some things we can control. Hypertension is attributed to weight. Heart disease, things like that. Being healthy to some degree is within our control. So what can you do? And again, not everybody can just go join a gym and work out 5 times a week, but what can work for you? Can you walk more? Can you quit smoking? Can you adopt some healthy things? It matters financially.
Bruce,
I like this.
Good advice. Thank you.
Thank you.
You can see Bruce here on Mid-Morning every Tuesday and get more financial advice on his show, Your Money, on CCO Radio. That's Sunday mornings from 8:30 to 9:30. A big addition.